What's up, guys? This is Frank Cosenza, your SIG chair. I'm here with Jeff Young, kinesiologist extraordinaire, and a very, very knowledgeable participant within the special populations, which he chairs, and our group, the special interest group for personal trainers. Jeff and I have been going back and forth trying to get a time together to chat. We finally settled on today. So today what we're going to discuss is concepts for program design. Jeff, I think you're what they say an expert in this, and you've done a few you've had a few talks of your own that you've put on. Why don't you, one, let the world know who you are, and then two, we'll get into the nuts and bolts of today's conversation.
Yeah, sounds good. And I really appreciate that you reached out to me last week and suggested that we talk. And for the viewers, Frank and I had a kind of introductory meeting ourselves on Zoom and just, totally hit it off. And we're just really seem to be in line with our philosophies on a whole bunch of things. And so I was just excited and honestly honored that that he's willing to have this conversation. So hopefully we can put out some good stuff for you. But as far as my background, kinesiologist, I'm in my 26th year, went to Penn State. And I'll try to be kind of brief about this, but I do want the viewers to know, or at least have an idea of what my passion is, because I try to be a voice as much as I possibly can for the field of fitness and the need to build the bridge between fitness and medicine. So I was the founding chair of a fitness and medicine group for a medical organization called the American College of Lifestyle Medicine. And my role there, I was basically chaired it until earlier this year, and it was about a 4-year stint. My role there was really to provide education for the clinicians in the organization. And because part of the reason why there's a disconnect is we just don't speak the same language, and it's a major problem. Right. We don't speak the language of medicine and sports medicine. They aren't really, I know I'm painting a broad brush, but they aren't really speaking the language of exercise science and strength and conditioning and fitness. And, and so that was one of my roles. And the other was just to help actually make the connection at the local level. And then I'm also kind of doing the same thing for an organization called the American Osteopathic College of Physical Medicine and Rehabilitation, which is physiatry. And I'm a content contributor for the American Physical Therapy Association on all this stuff related to exercise science, strength and conditioning, building the bridge, etc. I am on a working group called a Physical Activity Assessment, Prescription, and Referral Working Group for a huge organization called the Physical Activity Alliance. And I won't bore you with the details of that, but there's big dogs on this working group from the CDC, AHA, NSCA, ACSM, a whole bunch of other medical and fitness organizations to try to build this, make this connection from the clinic to the community. And then I chair the NSCA Special Pop SIG, and I'm involved with the Medical Fitness Association, ACSM, et cetera. So I know it's a long list, but the reason why I'm saying that, I volunteer to do all this stuff. So I'm definitely not saying this from a boastful standpoint. I am not getting paid, blah, blah, blah. I am doing this because I really have a passion for, trying to make these connections and also just to help educate both sides of the equation, the clinicians on what we do, but then also the fitness trainers on how to better speak the language of medicine and fitness, and so that we can be a little bit more seen as with value in their eyes, because they just all the problems that go along with that. So that's a little background on myself.
Yeah, I mean, you and I kind of go back and forth on Facebook. You post some things that are really insightful, really, really, really thought-provoking, and I think that's really where this collaboration began, was that you had posted a few things, and that sort of forced my hand to wanting to reach out. I mean, I can tell that you're extremely knowledgeable just by things you're posting, but I don't know that my special interest group knows who you are. So I wanted to get you on here, talk to you. Then, from our conversation, we started talking, just kicking it back and forth about concepts and information that you've put out with regards to concepts and yeah, that disconnect. But I think that we can sort of parcel that down and try to help many people on both sides of the equation understand really what the concepts that you preach are all about.
Yeah.
So as part of your philosophy, why don't you know, walk us through or talk to us about that the concepts that you like to teach as the governing rules that you follow when you're talking to either the medical professional or the fitness professional, and really just kind of walk us through that thought process, what it is, why, um, you know, sort of help us try to understand, because we talked about it at length. I mean, I couldn't get enough of it. We could probably sit here and talk about it all day, but we'll try to make sure that it's not overly overly drawn out. But yeah, walk us through your thought process when it comes to, that teaching equation.
Yeah. First of all, I just really appreciate the platform to be able to do this more than you realize. And I'm going to start with a little bit. I will also try to be brief and just kind of hit on the main points and walk through a little bit of a timeline. But I just think it's important to kind of go through a timeline. So I want to actually start with when I was a student at Penn State back in 95 and 96. I got involved in what at the time was the longest strength and conditioning study that had ever been performed. And it was under the direction of Dr. Bill Kramer, who, if you're involved with the NSCA, then he's the man. And rather than go into a ton of detail, I was learning about the principles of exercise, strength and conditioning program design in class, and learning about periodization. But some of it clicked and some of it didn't. But now in this study that I was involved with, I got to see periodization applied in a scientific and controlled setting, and it was performed for the United States Army, and the results were just absolutely amazing. And so I took this philosophy, and my first job out of college was at Duke University Medical Center's Diet and Fitness Center, which is a leading medical weight loss facility. So I went from this study at Penn State where the subjects were able-bodied, basically from 18 to 32 years old. So they were able-bodied, healthy people, and we were pushing them to muscle failure, and we were using a linear periodized protocol. I happened to be involved in the group that outperformed every other group, and the group that I was involved in was called the power group. So they trained in the 3 to 8 repetition range, and we were taking them to failure on every single set, excluding their warm-up. So needless to say, they really increased their strength significantly in a short period of time. So that was kind of the language I spoke. And then I went to Duke, and now all of a sudden I'm working with deconditioned, overweight, obese, morbidly obese, with all the conditions, both disease and musculoskeletal, that come along with it. And I had to learn, like, within days, you don't take this population to muscle failure, but it was the language I spoke. So I spoke this linear periodized language, and I learned quickly how to basically scale it and start using RPE scales, and rather than taking people to failure, sub max, but make sure that it's working sets, making sure that I'm training across a spectrum of repetition ranges and not just the 3 to 8 range, et cetera, et cetera. So then flash forward, moved to New York City, where I'm at now, Health Club World for a while, et cetera. But then in 2006, I was asked to create and manage the fitness component in a Mount Sinai, Beth Israel facility called the Center for Health and Healing. I was there for a decade. During the time I was there, we evolved into the most comprehensive urban-based integrative medicine and medical fitness facility in the United States. So it made me a unique product of a unique facility, in the sense that I either designed or oversaw the design of programs for just, disease and musculoskeletal issues across the spectrum of care. Anything, from disease, anything from your unfortunately common diabetes and obesity and hypertension to polio, lupus, multiple sclerosis, I could go on and on. And then musculoskeletal conditions from foot to neck and everything in between. And I noticed that, well, first of all, I kind of fell into I worked alongside our physical therapists, and I was kind of uh, drawn into that world for about the first 6 or 7 years, where I can see in hindsight, I became a corrective exercise specialist. And at the time, it was a means to an end. So at the time, my clients were patient referrals were getting better, they were feeling better, etc. But I found that I went from like a strength and conditioning coach for the first 10 years of my career. Now I'm at my 10th year, I'm in this hospital setting, and I didn't know what I was doing because we didn't learn in school how to design programs for people with all these disease and musculoskeletal issues and stuff like that. And so my ignorance was kind of exposed, and then I'm taken under the wing of the sports medicine team. I become kind of a corrective exercise specialist, and I was all about activating the transverse abdominis and serratus anterior and scapular this and all that stuff. In any case, long story short, about 7 years into it, I met a physiatrist who he competed nationally in Olympic lifting for a decade. He just missed making the 2004 Olympic team. He still holds some New Jersey state records. And he also was an honorable mention offensive lineman in football when he was in college. So this was an athlete who also, but an MD. So he kind of got it. He understood things from like the physician standpoint. His specialty is the spine. But he also understood from an athlete and getting injured and having to go through the whole continuum back to an elite level standpoint as well. And I won't get into a long story with this, but he's the one who kind of turned me back into a strength and conditioning coach, because he did a presentation for our physical therapists, like 25 physical therapists, where basically the theme of his presentation was, you can do all this corrective stuff all you want, but you got to get your patients strong, or because we need that tissue strength. We need the resilience. And those were the words I needed to hear. It flipped me right back, literally the next day, into being a strength and conditioning coach. But now I had been in a clinical setting long enough to understand how to scale things, which I'm going to get to in a second. And so now I consider myself a strength and conditioning coach who works in clinical settings and understands how to scale things. So now to more specific, with that as a background, to more specifically answer your question, just a quick share screen and a slide that I showed you last week.
Yep, I remember. I recall it.
So I'm heavily biased towards this. I honestly just think that I kind of just consider myself a principles guy. In other words, I'm not like the Jeff Young's functional, fun and entertaining fitness method. I'm just know your principles and apply them. And that's literally all you need. So
Yep.
what I'm getting ready to show you, I actually just had a presentation with that physiatry organization, the AOC PM&R, last night, and went over this. And they were loving it. As a matter of fact, they commented afterwards that what I described to them, now keep in mind, these are physicians. These are med students, residents, fellows, and physicians. So they see things from that standpoint. And what they said with what I'm getting ready about to show the viewers is that this is the continuity of the continuum of care. So with those words in mind, let me go through this real quick. So in the big circle is basically ACSM and NSCA guidelines. And what I do is I break down program design into two categories. There's the initial program design, which is known as the familiarization phase or the adaptation phase, where for a new exerciser, we need time to allow their body to adapt. It really closely mimics what goes on in traditional physical therapy, in the sense that it's RPE guided, the intensity's low, you're teaching proper form, developing, motor control or mind-body connections, you're determining your exercise selection, and also you're determining the person's pain-free available range of motion. And that phase can last anywhere from a few weeks to several months, depending on the person, their fitness level, condition, etc. But from there, at some point, the training wheels need to come off. At some point, we're done with the low intensity stuff. Their sets should have progressed during that time to true working sets, and they should become familiar with the exercises. At that point, what I do is I put them on a linear periodized model. I love nonlinear, but I'm just a believer that early on you should start with linear, because it just makes sense to start with lighter loads and higher reps and work your way down in phases. So what I'll do is I'll start in the initial program design at 10 reps per set for X amount of weeks, and then I will move them typically up to the 12 to 15 range, stay there for like a month, then back down to 10 to 12, 8 to 10, 6 to 8, all in like 3 to 4 week phases. So there's your main framework of the program design. And then within that, I'm also always thinking about the body seeks homeostasis. It seeks balance, whether it's your blood pressure, your blood sugar, and it also applies to the musculoskeletal system. So I'm also always thinking about balancing strength around each joint, balancing flexibility, or the easy way to do that is just do a joint range of motion assessment, find where they're tight, where the restrictions are, and then just get them on a proper program to get rid of those restrictions, and then that will in theory balance things out. I also make sure that I always incorporate readiness to train concepts. So prior to, if like Frank, if you were my client, and even if you've been training with me for 10 years, 3 times a week, and you never missed a session, I still would ask you prior to every single session, how's your body feel? How'd you respond to the last session? Did you eat? Are you hydrated? Did you take your medications, et cetera, et cetera? Because I got to determine in the short term what's your readiness to train and whether or not I need to make adjustments in our session based on your answers. And then lastly, there are special considerations. So for the person who has a chronic disease, for example, let's just say it's multiple sclerosis, just as an example. Special considerations for that would be things like make sure that you train this person in a cool environment, longer rest periods between sets, make sure they don't get overheated, make sure they're hydrated, so their body's thermostat is working properly, et cetera, et cetera. But the bottom line is we as fitness professionals need to know special considerations for each condition and how to insert. And literally you can just insert that is the reason why I have these arrows here. You can just insert this stuff into the main framework. And then lastly is special considerations for musculoskeletal issues. And that's going to be what I like to call joint friendly exercises. And just to give a quick example, like for the knee, for most knee conditions, there's always going to be outliers, but generally speaking, for most knee conditions, even with where they lie on the spectrum of severity, deadlift variations, or any type of hip hinge, whether it's like a bridge or a hip thrust or a deadlift, are typically knee-friendly exercises. Leg press is actually a very knee-friendly exercise because you can load the person up below their body weight and build it up. And actually even squats and things like that can be knee-friendly as long as you're staying within their available pain-free range of motion. But the point of all this is that this is, to me, the prototype. This is the protocol. And let me end with this. As you saw yesterday, I purposely posted that survey question about, what's your style of training? And I posted this question on my own timeline, NSCA Special Pop SIG, your group,
yep,
ACSM, ACE, NASM, ISSA, and another fitness group. So I posted this in like 7 different groups. And I got a lot of responses, and I wanted to see, would anyone respond saying periodization? Would anyone, whether it's linear, non-linear, would anyone respond saying things like, I make sure that my style includes balancing, balancing strength around joints, or any of these concepts? And there was like maybe 2 or 3 people who did out of a lot of people who answered. But the most common answers were things like, constantly switch things up, work out of the day, make things fun and entertaining, functional fitness. Well, to me, that 70% of the population of here in the United States has either disease or musculoskeletal issues. To me, we need structure, and the more everything works on a continuum, and and because of that, there's a trade-off. And so the more you are concerned about keeping your client because you want to make it fun and constantly switch things up with variety, the more uber variety you have, the less structure there is. And we can put plenty of variety in this type of program that I'm suggesting, with just varying your types of squats, varying your deadlifts, multi-directional lunges. There's plenty of variety. We can make it fun and entertaining with a dynamic warm up or with a conversation you're having, things like that. Strength is corrective. So for those who say I'm corrective or therapeutic based, strength is corrective, and balancing strength is corrective, and doing things with proper form is corrective. So so I'll end with this. You can take all those styles and put them within the framework that I'm describing, which is just much more logical, and it's principle based. It's ACSM and NSCA principle based. And if you just do that, this little share screen I have up literally shows you your short term, from the readiness to train to what a session should look like, your midterm, what a phase or maybe a cycle looks like, and then your long term, because this would be a lifelong program as well. So that's where I know this might be a little politically incorrect and might ruffle some feathers, but that makes for good discussion sometimes.
Yeah.
And that's where my problem is with all these different styles. Don't have your style, but fit it into some sort of periodized structure.
Right.
That's my philosophy.
Yeah. And I think we discussed it kind of last time about a proprietary blend or a specialist thought process. And the reality behind it is, when we were talking, is there's no real reason to reinvent the wheel, right?
Exactly.
Like, you're going to have all these clients from all different walks of life, and it really doesn't matter whether or not they have a very, very niche special consideration you have to make, whether it's a physical limitation or injury or ailment, or if they're an athlete, right? The purpose of a strength coach is to gear the program to build into that special consideration. So whatever it is, but I think the fabric that should be interwoven in all of that, and I might ruffle feathers, is the strength part. And you can't really measure strength when you're jumping from one exercise that's Bosu hops into trap bar jumps with a box jump into unstable planks with rubber bands and chains, right? Those are all fabulous exercises, but perhaps we're overstepping our bounds in terms of we're not asking the right question. We're not engaging that person to challenge them from a strength consideration, which, again, it really should not matter, because what you just mapped out should really just be a standard approach as fitness professionals or health professionals that we all adhere to, because it's logical, it's stepped, and in that structure, you can put whatever exercises you want, as long as you're making all the right considerations for each individual. So that's where it becomes specific. And that specificity only lends itself to whatever the consideration has to be, right? Whether it's a multiple sclerosis person, an athlete coming off post-surgery, an athlete that's completely fine. Because the reality is, you need to measure it over time, and it should be something that can be reproduced. And if you're constantly switching things, there's so many variables, you can't really reproduce that.
Yeah. You're actually reminding me that during this decade that I was in this Mount Sinai system, our head physical therapist, who was amazing, I learned a ton from her. She was a primary physical therapist for the Knicks, Yankees, Nets, Liberty, etc. But she was an ultra variety type of person. And she didn't have an exercise science background. So she was really good at rehab, at determining the person's initial capacity, whether they were an athlete or, general population, older, whatever, and understanding how to appropriately push them during the time they were in rehab. But she was this, ultra variety person as well. And I remember one of the other PTs who got along with real well, and he and I got in a debate with her one time about all this variety. And he said to her, how do you track their progress? If you're constantly switching from one thing to the next, how are you tracking their progress? And we ended, we won that debate, because you can't track the progress.
Right.
And so it really just goes right back to what you just said. Yes, we need variety, because you got, keep the person interested and stimulate the nervous system and all that stuff. So yeah, you absolutely, the principle of variation. So it's a principle, but there's a trade-off, and you need structure too. And And yeah, and so what I found is that what I just showed in that share screen, that slide, is provides your general structure, and that the difference from individual to individual. Now, of course, and I'm not talking about athletes, so I just train for the
Right.
most part general pop, special population. So what I'm getting ready to say will not real. Some of it will apply to athletes, some of it won't. But
Right.
what I found is what I showed is your general framework, and that the general differences between one person and the next are things like their well, motivation is going to be one thing.
Right.
But things like their initial start points with loads, their rates of progression will differ from one person to the next. Their available pain-free range of motion will differ, and because of those things, the exercise selection might differ. But
Exactly.
despite that, I am still a squat, deadlift, if they can lunge, push, press type of person, because if my job is to teach them, for example, how to sit to stand properly. If they can do that, they can do it against resistance, which means they can squat. And I don't automatically default to a goblet squat, for example. If we can get a bar on their back, I'm putting a bar on their back, and it might only be a 15-pound body bar, but I'm putting a bar on their back, and sometimes I bypass things like goblet squats. But my point is, if they can squat with their body weight with proper form, they can do it against resistance. We're squatting. If they can hip hinge with proper form, we're deadlifting. It might be rack pulls, or something like that, but we are deadlifting, because one of the things I want to do is take them through this 12 to 15, 10 to 12, 8 to 10, and eventually 6 to 8, because we got to get them as strong as their body will allow us to get it over the course of time, so that they can fight back against whatever their condition is, or prehab, or whatever the case may be. So yeah, I just wish that this was more common in the fitness field.
Well, I mean, I don't think that you're fighting that much of an uphill battle, because I think there's more people that think like us than we know. But there's that thought process, like you said, when you get, even when you have someone that's considerably educated that does like the variety, whether it's because it bores them to do the same 6, 7 movements over and over again. But in the reality is, our goal as fitness professionals, health professionals, coaches, is to make that person stronger. And when we make them stronger, they can then apply it to whatever walk of life they're coming from. And again, the strength could be relative to that individual, right? Maybe they started with just body weight range squats, but you eventually get them working through your thought process, 12 to 15, all the way down to 6 to 8, or 3 to 8. You
Yep.
get them to lifting body weight. And now it becomes, there's the challenge, there's the fun of it, because now you get to see, an actual increase, a metric that you can measure over time, and it becomes like the carrot in front of your face running, and that's a tangible thing, that's real. And I think that some fitness professionals, they don't want to give their clients the carrot, because if they lose their speciality of switching things up, of making it fun and entertaining for their clients, they get the client the result, they lose the client, because the client has now superseded their ability to train them, right? But that's self-defeating, because I know more than you. If I can continue to put you into this thought process and make you stronger at each turn, well, then it's infinite.
Yeah.
It never ends. So why would you want to train a client? It's the thought process of giving somebody a fish or teaching them the fish.
Yeah.
You can teach somebody how to fish, they're still going to come back to you, because you might have a different way of looking at it. You might show them a new technique. You can show them different exercises, right? Because inside of your framework, what makes it unique is that, you said something that I might not do, right? I might always opt for goblet squats to start with somebody that can't do anything, once I understand that they can do a bodyweight squat. But you're like, nah, we're gonna go right to some kind of barbell squat. Oh, there's a differentiation right there between our styles. That makes it unique to you and me,
Exactly.
which again, but we're using that same framework and structure. The exercise selection is where you get to really show your skills. And for whatever reason, across the board, that's one of those things that I think fitness professionals tend to believe that they can't use the same structure as somebody else, or that having, you know, a very, very specific detailed plan doesn't allow them to flourish, because it hamstrings them, no pun intended, from showing their flair, their skills. Whereas I think of it is, man, if I just use a structure and everybody can fit inside that structure, all of the different exercises, all the tools that I have acquired over the years allows me to really flourish, to demonstrate why you're hiring me, why you're paying exponential amounts of money to work with me versus somebody else.
What you just said is so well said that I really mean it. What you just said is so well said. There's nothing I really have to add to it, because you literally just defined how I've been training for the last 26 years. I am so much about that carrot that you described, those metrics. I am so much of an objective person, and understanding what like the norms are, or even if you don't know the strength norms or whatever, that's actually okay. But making sure that, for example, in the 12 to 15 phase, let's say it's a 4-week phase, that objectively we're a little stronger than we were in week 4 than we were in week 1, which then prepares the mind and the body to drop down to 10 to 12. And then objectively in each exercise, just make sure that we're a little stronger in the beginning with each exercise than we were in the end, which then prepares the mind and body from when we drop to 8 to 10, etc. I am so much about those objective metrics, that carrot that does make it fun and motivational. That is absolutely a way to make things fun. It is fun for them to see that they're getting stronger, and then all the daily life things that go along with it. It's easier to, my runs are better, it's easier to get up the stairs, you know, whatever the case may be. So what you just said regarding that is just so, like, it's literally defines who I am as a professional. And then the other thing, you know, regarding, like, you're so right. It's everyone is so concerned about their own niche that it's become niche on steroids in our field. And I actually would go so far as to say that it can be a little bit fraudulent or equivalent to malpractice in medicine or something like that, because you're being too selfish. You're so concerned about your niche that you're being selfish and not optimizing the program for the client, because it is not optimal to put someone on where you're just switching things up every day and all you care about is fun and entertainment. You can fit all that stuff within structure. And
Absolutely.
yeah, you absolutely nailed it.
Yeah. Just to dissect for myself and you in terms of concepts, and talking about the carrot and how I'm objective as well. For, I don't know, there's a handful of different types of squatting programs I've done where literally it's just squats 3 times a week, and different percentages. So if you use an RPE scale, which is rate of perceived exertion, you're really looking at, sometimes it's at 7, other times it's prescribed that you have to be at the 8, and then it's prescribed you have to be at the 9, 10 range. And I actually took it a step further. I've done those programs a handful of times when I was Olympic lifting, but I took it a step further where I was like, okay, breaking down my squat, looking at my squat, I looked at it and I was like, I'm going to stay at the 7 or 70% RPE percentage. And what I'm going to do is I'm going to try to think about every week performing a different variation for the same reps, same sets and reps. So if it's 4x5, it's going to be 4x5 for the next 6-7 weeks. And I'm going to try to do 4x5, 4 sets, 5 reps of 70% of whatever I perceive or believe my 1RM to be, my 1 rep max to be. And I'm going to do tempo squats. I'm going to do pause squats. I'm going to do 1 plus a quarter squat. I'm going to do full squats. I'm going to do partials, or combine them where I do 1 tempo into a pause, into a full, and just tried to change one variable, but never change anything else. And I performed that multiple times in the career of my working out life. But literally just using one percentage, one rep and set scheme, just change a variable. And let me tell you, when you start thinking about, oh, I can squat 500 pounds for one rep, and you do a percentage of that, and you try to manipulate that one variable of how fast you're moving the bar, whether or not you can pause it and then do a full rep, how long you hold the pause, the 1+1 rep, things start to change. And now the variability of just changing that one thing makes it unique. It makes it a different challenge, and then offers you a whole new perspective on it, right? I'm not just doing a squat today. Today I'm doing pause squats. And if you've ever done a pause squat versus a full squat, it's a different beast. But you have to do it with the same load you lifted last week for the same number of reps, and it changes things. And I think far too often fitness professionals just blow past that. They don't want reps that are challenging. They just want their client to sweat. Well, let me tell you, when you do a pause squat at the same percentage that you just did full squats the week before, you're going to be sweating. You're going to get a whole new feel. And I think part of the reason that you and I are resonating and vibing on the same things, because we both think like that, right? Like, I don't need to change the exercise. I can change how you do the exercise, right? Make you do it twice, get you out of breath, do it again. It's one of those things where if you just look at concepts and then variables on top of concepts, how much variety that offers, you don't ever want to try to switch it up, because again, you can't record it.
First of all, you need to move to New York City so that we can start our own facility, man, because I'm serious. While you were talking, I actually pulled up a document I have, just so I could make sure that I'm correct with my wording. But the principle of variation states, and this is an NSCA, ACS, I think it's NSCA. It's either ACSM or NSCA. But
right.
The principle of variation states planned variation, which can include exercise selection, but the emphasis is on frequency, volume, sets, repetitions, loads, rest periods, order of exercise, exercise tempo. So, related to what you just said, yes, you can switch up exercises, but there are so many things you can switch up within those exercises, and they are new stimuli for the client or the athlete, and what the person doesn't need all the time. Like, I think trainers tend to think that they're assume incorrectly that the client or the athlete needs a new exercise. No, they need a new stimulus.
Yep.
That's all the central nervous system really needs, is a new stimulus to adapt to.
And it doesn't need to be a grand one.
Exactly. It literally can be something as small as what you just said. It could be something as simple as going from a high bar to a low bar squat, from a back squat to a front squat, from a sumo to a conventional, or to a trap bar. It literally can be it just needs a new stimulus to adapt to. And so I'm just a believer that I'm not opposed to throwing in, like, for instance, maybe having a phase for general fitness, for example. Maybe have a phase where go ahead for 2 weeks and just switch things up as much as you want. Do it in the form of a phase rather than the form of that's the way you train everybody all the time. So do it in the form of a phase, but I'm just a believer that literally exactly what you just said. You can take your squats, your deads, your lunges, your push, your press, and you can vary attributes within it, and that's going to be enough of a stimulus to keep them interested, and also to help gain strength over the course of time, because now you're doing pause squats, blah, blah, blah. So yeah, I just absolutely couldn't agree more.
Yeah. So one of the things that we had talked about and we've sort of discussed ad nauseum at times is really the thought process of, what strength is. I think sometimes we neglect as professionals to really understand what the strengths that we need to craft or create for our individual clients. Again, that changes how you approach things. And sometimes I think as trainers, right, I had this conversation with a woman at the gym I go to where I was like, it is a CrossFit gym. I do not CrossFit, but it is a CrossFit gym. Where I was trying to explain to her, like, CrossFit is one of the greatest examples of if everything is without a variable. So there's no injuries, you're completely healthy, and you can perform all the different exercises. It is a great thought process because of the programming of how it is so varied. However, here's the big thought process that I try to explain to her, and which I think we agreed on. You need to be able to perform all those exercises to a very, very polished, specific ability before you vary it. So if you're talking to the gen pop or even an athlete and you want to throw in a catch-all or transition phase for 2 weeks where you just throw a bunch of exercises at them, they have to know how to do those exercises well. So in your bubble, that beginning phase where they're, the shaky legs, they're showing you whether or not they can perform the exercises, that gets done first before you start changing a bunch of variables. So you understand from the coaching standpoint that your client can do a proper squat, loaded or unloaded, with good mechanics, right? There's no limiting factor, all ranges, and then you can then switch it up. So right before you test whether or not the person like myself can do a pause squat, they have to show you that they can do a regular squat. And then when you do a transition, then you can change your variables of the same movements or, throw new movements at them if they have shown you they've done it. And I think a lot of times that component gets overlooked because, why do a proper bodyweight pull-up when you can flail like a fish at the bar and do 600 pull-ups?
Yeah.
Well, those 600 flailing pull-ups don't teach you how to do a proper push-up, which for the general population, you need to learn how to do because it demonstrates a certain amount of strength, body control, and then muscular joint control throughout. So, there's a give and take. Do I like the 600 rep idea and thought process? Yeah, for some people. Do I like everybody be able to do a proper pull-up? Yes, and that should be a global answer across the board. If you want to change a pull-up, you first have to be able to perform a real pull-up.
Yeah. Yeah. You actually just so that kind of goes back to when I did that share screen and starting with an initial familiarization phase, which you also can call the learning curve phase.
Correct.
Literally exactly what you were just describing. And so on that note, I always start everyone on a linear model, and then in a perfect world situation, I would then at some point transition them to a nonlinear model. But everyone who gets referred to me gets started on a linear model. And so related to what you just said, the first week, let's say my phases are 4 weeks. The first week, I back off the first week, and it's another learning curve week. That's actually part of the reason why I do 4-week phases, because then we can have a legit 3 weeks to start to increase their strength or whatever, because maybe I will introduce a new exercise or a new variation of an exercise. And just like you said, we need to make sure that they're doing properly. So yeah, I couldn't agree more. You nailed it when you said that it just seems like so many fitness trainers are bypassing that and just throwing a new exercise in, and the poor client doesn't know, that they don't know how to do it properly. And then they're being expected to do it under conditions of fatigue. So they sweat, whether it's via loads, whether it's via high reps or whatever. So you're asking them to do a novel exercise that they're unfamiliar with under conditions of fatigue. And that's just not a good thing.
Right. Totally. Yes. 100% agree. All right. So now that we got your philosophy out of the way and we discussed, actually, you kind of said it, you stated that you do all of the different groups that you're in for free. My question to you is, why do you do this?
Yeah,
why are you putting yourself out there?
Yeah. There's probably, so this is something that we did not discuss. So this is
Correct.
this is a on the spot question, and uh, at least two things come to mind. One is I had Bill Kramer as my academic advisor at Penn State, which is just ridiculous. I was an adult student, so I went from the age of 27 to 31. So he was my advisor, my academic advisor, my senior year. When I learned um, in my second semester junior year that he was my academic, that I was switching academic advisors, I set up an appointment with him. I'm now 30 years old. I have 1 year left. I'm starting to, just like all juniors, I'm starting to get scared because the reality of, oh my God, I'm getting ready to graduate soon. This is flying by faster than I thought, is starting to hit me. And I remember asking him in a meeting, what should I do regarding grad school? Because at the time I just didn't really have the finances. I had the desire. I wasn't sure if I had the time, but I definitely didn't have the finances to go on to grad school. And so I asked him what his advice was. And this is many, many years ago, but generally speaking, what he said was, if you have the time and the desire and the finances to go on to grad school, go on to grad school. You continue your education. And also you obviously have to stay on top of research and things like that. But he said, what's going to make you successful in life is networking, networking, networking. It's literally exactly how he said it. And 26 years later, it's still like on the front of my mind. So why do I do all this stuff? It has allowed me uh, incredible opportunities to network with incredible people. Why am I chairing the Special Pop SIG? Networking. Why am I and so that's a huge part of the answer. And it has allowed me some opportunities, which then not only it gives me credibility. You have to be patient. This stuff doesn't happen right away. I have to be patient and kind of work my way up and all that stuff. But then it gives you credibility, and it just offers other revenue making opportunities as well. So I do things for free, but then it leads to revenue making opportunities. So I think that's probably my best answer to your question. And also, the other part of the answer to your question is I truly love doing it. I truly have a passion. When I worked in this Mount Sinai system for a decade, and I could clearly see the disconnect between medicine and fitness, the egos that go along with it, all the politics, the bureaucracy, the frustrating part that people just don't want to talk about because it's taboo to talk about it and all that stuff. And I thought to myself, no, if I do this stuff for free, then I don't have a dog in the fight, in the sense that I don't need to be married to these organizations. I'm doing it because I want to volunteer. And it allows me to be more confident with my voice and to say some of the things that people don't always want to hear. That's another reason too. I have a huge passion for wanting to play my role in connecting medicine and fitness. And by doing it from a volunteer standpoint, it allows me to not feel like my voice is being dampened. It's always going to be dampened a little bit because you always got to watch what you say if you want to keep your position, etc. But those are the reasons. It's a true passion, and it allows networking opportunities. So that's the reason why I do it.
Awesome, man. I love it. I love it. Yeah, that's amazing. Those are two great reasons to do this. The passion and love that you have behind it. And when you're putting yourself out there, you're connecting with more people. Inevitably, it always leads to new conversations and then new endeavors, right? The potential
Absolutely.
is always there, but you have to talk to people.
Yeah.
All right. Before we get going, how do we find you? How do we connect with you? I know you're heading all of these groups, so you're busy all the time, but is there a way to actually get a hold of you besides, just stalking your Facebook page?
Yeah, when it comes to social media platforms, unfortunately, currently I'm not really an IG guy, so I'm on Twitter a little bit, but it's mostly Facebook. So I think the best ways to connect with me would be Facebook, just following me, sending me a DM. I always respond to DMs. My email address is for the NSCA viewers, is on the website. All you have to do is look at the SIGs and you'll see what my email address is, but it's jykinesiology@gmail.com. I will answer your emails. And that's actually probably the best ways. And then also, if it was like, for instance, a small group of people who wanted to just talk shop or had questions or something like that. I love getting on Zoom like this. And
Yeah.
I would be absolutely all about just holding an occasional. In fact, that's what we'll be doing with this special pop SIG is just, as chair of the SIG, just holding occasional Zoom
Yes.
meetings where we can talk shop and all that stuff. So, become a member of our special pop SIG. And then when myself or one of the executive council members has a virtual meeting, attend the meeting. So I think those would probably be the best ways.
Nice. Awesome.
But you
All
can't
right,
have
man.
you can't have my cell number because I don't want 3 a.m. texts.
Damn it. I was really hoping you'd give that out to get the digits. Before we close for today, do you have any closing thoughts or anything you want to, miscellaneously drop a knowledge bomb right before you head out for the rest of your weekend?
Actually only to say to once again, thank you because, we're just getting to know each other, but, we're obviously just really on the same page. And, it's obviously always, it just makes you feel better when you're talking, when you're within that company of someone who speaks the same language and stuff like that. So, I hope that you and I can also, as chairs of these SIGs, to start talking with other SIG chairs and just starting to get this message out throughout the SIGs and therefore throughout the NSCA. But the other thing is that I just really hope that whoever views this, that they really put some thought into what we were saying, and kind of using what we were saying as a mirror and comparing, contrasting what our thoughts are, which I just would like to think are principle-based, logical-based, common sense views, exercise science and strength and conditioning guideline views, and just take what we said, use it as a mirror, compare it, contrast it with your view, and just check yourself and just say, what are there areas that I can improve in? Maybe I am a little bit too much of a variety person, or maybe I am a little too concerned with correctives and it's keeping me from going into those lower repetition ranges and getting people stronger, etc. So that's honestly my closing thoughts. Please just take this this information that we gave to you to heart, and and decide for yourself if what out of it you would like to utilize, which in my biased world, it's 100% of what we said.
Yeah. And I can't agree more. Really, what we talked about was the structure, the framework for writing and creating and crafting a proper, logical, stepped, periodized program. And anybody that's out there who does struggle or is not having that conversation with themselves, hey, we're here. Jeff gave you his information. I'm the chair, obviously, of the personal trainers special interest group. So we're here to talk about that stuff. And one of the main reasons why I wanted to get you on here was because of the fact that you had that lovely PowerPoint, is really to demonstrate that you're using it from a clinical setting. I use that same thought process from a performance setting, and it works both ways.
Exactly.
It's a great tool and asset when you understand that concept can be applied really across the board.
Get this, man. So I'm an internship provider, like for Penn State, and for several local New York City colleges, Hofstra, Mercy College, etc. And when I first started being an internship provider for Penn State, and this was actually while I was still at the Mount Sinai Center for Health and Healing, one of the interns, kinesiology student, was also on their tennis team, so D1 athlete, and he went to Duke DPT student. I'm sorry, went to Duke Doctor of Physical Therapy program and is now a practicing PT. And I explained, this stuff during the internship, and her response was, and of course, I'm explaining it from a special population standpoint or from a medical fitness type of standpoint. And her response was, shouldn't this apply to everybody? And there you go. And you literally just said it. You just scale it to the individual. You scale it to the athlete. You scale it to the general pop. You scale it to the special pop. But these are the concepts that literally apply to everybody.
Yeah, they're sort of across the board. They're
Yeah.
definitely user friendly, and
Yeah.
really within the framework, that's where you get to show off. You get to show off your knowledge of the different exercises and how you apply it, right? The different variables, the considerations you make for that person. And ultimately, we, Jeff and myself, wanted to put it out there, have this conversation to invoke others to think about it, right? To look yourself in the mirror, ask yourself, do I understand this concept? Am I using this concept? What am I doing that's considerably like it or dislike that particular thought process? There are many out there, but if you utilize this one particular concept that we discussed on the framework, you're going to be better off for it. So
Right.
that's all we had today. Thank you very much from the
Yeah.
bottom of my heart for talking to me.
Absolutely.
I appreciate it greatly. Yeah, I mean, hopefully we get to chat more and do this. I look forward to having the chair meeting with everybody so that we can talk shop. It's always
Yeah.
great to talk to another person, like you said, that's like-minded, that does get it, that you could then talk about, greater channels of information.
Yeah.
I appreciate your time. Have a great weekend, and I'll look forward to talking to you in the future. And again, keep posting because I love your
Yeah.
posts.
Yeah. Let's keep this conversation going. I really mean it. And I'm going to start bugging you now that I'm getting to know you even better. I'm really going to start bugging you to move to New York City so that you and I can open up our own facility. So those are my parting words, man. You're coming back
Yeah.
you're coming back to New York. And I'm going to weave you into my evil web. That's my parting words.
Awesome. I mean, I'm not against it. Not against it.
All right.
All right,
All right,
man. Take
Frank.
care.
Yeah. You have a great weekend as well.